Well, as we've reported all week, Wisconsin's COVID vaccine rollout has been slower than 34 other states.
The good news, another vaccine could be on the market in the next couple of months, and that could help protect even more people. Dr. Zorba Pastor is back to talk about that. He'll also be taking your calls. We'll let you know when to call in. Hi, Zorba. How are you?
Hi,
Good to see you
Zorba.
guys. Very good, thanks.
So a third vaccine possible.
That's right. This is the Johnson & Johnson vaccine. We don't have the data yet on it because J&J hasn't released it yet, but the data's looking good. It's a one-shot vaccine. Not sure what the side effects are. My guess is going to be very similar to the other vaccines, but the good news is it's only one shot instead of two. Now we just have to look and see whether or not it's 95% effective. That is a big bar. 95%. The Pfizer and Moderna vaccines are 95% effective, and the good news is also is that effectiveness seems to kick in on day number 10, which is astounding. You've got to get the booster, but at day number 10, the curves separate, and it looks like you are pretty much in the 90% immune on day number 10 after the vaccine, and that's astounding news. We'll see if the J&J vaccine is the same.
Yeah, that's very encouraging. You just got your second dose of the COVID vaccine recently. How are you doing?
I did. I'm doing good. I had some pain at the site, just like tetanus shots, a little bit of pain on the site. And in the middle of the night, when Mother Nature called and I had to get up and go to the bathroom, I had chills, and my solution was to put on a long sleeve t-shirt. Easy solution to the chills. And I felt a little chilly the next day. But basically, that was the good news. It meant my immune system was ramping up. The chills meant my immune system was actually, for that second shot, mounting a response. So I didn't look at it in a bad way. And I think everyone has to balance. You've got chills, fever, maybe not feeling perfect for a day or two on one hand, and the possibility of death or bringing death into your house on the other hand. Weigh them both together, and I think you'll make the right decision. Get the shot when it's offered. And unfortunately, our state is number 34 in the country. That does not make me Badger proud.
No, not at all. So could you still spread the virus?
Well, we don't know for sure. In other words, and public health, Dr. Fauci and others say, we don't know whether or not you can spread it. But usually when you're immune, you don't usually spread it, or if you spread it, it's less likely to spread. But right now, the jury is out on it. We don't have the data. And so even though you've got your immunization, you still have to socially distance, wear your mask, wash your hands, and be careful inside. You still have to follow all the same, because we really don't know whether or not it can be in your nose and whether or not you can spread it.
What are you telling your... Oh, I'm sorry, Mark, go ahead. I
was going to say, Zorba, when will the day come where we don't have to do that?
In the future. That's about what I know.
I mean, do you need like 85% of the population?
I think that this summer we are going to have festivals. That's what I think. And it's really a function of whether we roll things out. Now, this morning I heard on NPR that in Phoenix, they're actually opening up a field just like Camp Randall, and they're immunizing people 24/7. They have people around the clock. And the fact is, in this state, we could open up things more. We're number 34 in the country. North Dakota, South Dakota are number 1. And number 2 based on yesterday's statistics. And the reality is, why are we number 34? Why aren't we getting more vaccine out there? And this is a failure in deployment. Now, where that failure lies, I don't know. The real issue is, how do we get it more? Now, we are giving it, most importantly, to EMTs, firemen, and policemen. They're next in line. And then it's people over the age of 65. But we should be immunizing 24/7.
Absolutely. All right, the phones are already lighting up. 270-9933 is the number to call to talk to Dr. Zorba. We'll get to your calls right after this.